Hello, good day. My name is Dr. Yusuf Mathai of Oregon Health Direct Primary Care. I know what you're thinking. What's the catch? This is too good to be true. And again, in life, if something is too good to be true, you really need to be asking, what's the catch? That's a hard question to answer because honestly, there is no catch in terms of what we're doing. Again, we are not promising the moon, but we are promising a much better primary care experience because it is possible to do it and still contain the costs. And one of the reasons we're actually able to do this is panel size. So when I worked at one of the big regional medical centers, I was often responsible for a panel size of about 3,000 to 4,000 patients. What that meant for my patients is that, when they'd called and they'd try and get in to see me, the wait was probably, a week and a half to get in. And when patients actually got in to see me, because I have to be able to see, that volume of patients, it was between 25 to 30 patient visits a day. Again, it's a 10 to 15 minute patient visits. In this model, we are really able to scale down on the number of patients that we are able to take care of. And that number ends up looking like about 800 to 600 patients. Now, that might sound like a lot of patients to you, but again, compared to a panel of between 3,000 to 4,000, that's much, much less. The other thing that we're actually able to do here, which again, because we're not having to bill insurance or we're not having to play insurance games, is what constitutes an office visit is actually very different from what you might think. So a lot of times we are able to triage a lot of things with patients just by a phone call. Patient calls and says, hey, listen, I have this going on. What do you think? It's easy enough for me to triage that over the phone with the patient as opposed to having to have them come in, physically see them. So again, office visits for us do not necessarily have to happen at the traditional setting of you having to come in and see us here. Sometimes we're able to come into your house, someone is really, really sick, we're able to do home visits. Again, that allows us to still provide that level of care, without having to, have you come in and actually see us in the office. And so there really isn't any catch. But again, not every patient is going to be able to fit what we do. And often we tell patients, before signing up, come in, see us, talk with us, see who we are, make sure that we are a good fit for you, and vice versa. Again, the idea with this is we're building relationships, and not every relationship is going to work out, but we want to make sure that at the offset that you fit us and we fit you.